What are some of the biggest issues in the world right now? A lot of people would say things like poverty, politics, the environment, global warming, but they all stem off of one thing, and that's our health. That's something that universally connects us all. So I've been doing a lot of research into the power of VR and the power of technology and how we can use that to actually solve some of the biggest problems in global health today. Virtual reality has been some of the biggest marketing buzzwords for things like gaming, television shows, basic medical practices. But a lot of people don't understand that there is definitely more to VR than just gaming. The reason that VR is so underdeveloped is because we only look at it in the context of things like gaming or basic medical practices. But if we want to look into a different future, we have to start thinking about how we can revolutionize virtual reality for that future. This idea of virtual reality is pretty self-explanatory. It literally means immersing yourself in an entirely different world. Now, this world is obviously computer generated, but it's had the power to literally make you feel like you're just in a physical environment. That's the real power of virtual reality. Now, I broke this down a little bit in my last video, but I'm going to talk a little bit about the applications and specifically what I've been focusing on when it comes to the intersection of virtual reality with medicine.
Now, while it is evident that surgery requires much more practice and proper technique, there were really not that many efficient ways to gain experience doing so until the rise of VR came into the picture. Methods of scans such as MRIs and CAT scans can only reveal so much about what the patient is experiencing. Doctors really need to see the full anatomy. Well, that's where VR comes into the picture. VR technology actually allows for these images to be projected into a 3D model. So physicians and researchers are able to observe the detailed parts of the anatomy, therefore stimulating surgery even before they're able to step into an OR.
Okay, so now that we've discussed some of the applications of virtual reality in basic medical practices, let's take a look at something a little more advanced. Recently, I've been looking into the fields of global health and how virtual reality can play a huge role in that. In my opinion, everything stems off of our health, right? You can't do things like go to school or have all these really, really sick applications if your health is not even intact. That's where the idea of global health and international medicine comes in. So I've been doing a lot of research into why global health is such a problem and why we should really be narrowing down our resources, especially technologies like virtual reality, into solving this type of problem.
As the supply of patients is increasing, the amount of doctors are decreasing. This means that the future of physician-to-patient connection is really unstable and hitting an all-time low. There is a major shortage of doctors in countries that need it the most. According to a study done by the World Health Organization, over 45% of member states, developing countries as expected, report to have less than one physician per 1,000 patients. The WHO standards reveal that at least one doctor is recommended per 1,000 people in the population. But why does this matter? Why am I talking about all of these statistics? Well, if you think about it, the whole reason global health problems exist in the world is because of these factors of not having enough doctors for the amount of patients that are in the world, especially because of their environments and where they live that really causes them to have unsanitary conditions. But if this is just the case, then there must be some sort of solution that we can use to solve that, right? Luckily, there is. There is an interface that's being used right now that connects doctors and patients all over the world. This idea of telemedicine, which is a subset of the medical field for online communication, provides an amazing amount of resources for so many patients worldwide and allows them to connect with experts from any hospital and get medical consultation or even having them to be remote monitored. The field of telemedicine was constructed for this exact reason of global health inefficiency. Not having doctors and patients and not having that sustainable ratio for most medical systems is what led to the development of telehealth in the first place. But there are a lot more issues to telehealth than a lot of people don't see. For example, telemedicine still continues to be technologically limited. But if we think about it, so is our scope of thinking about the possibilities. Any idea starting out to be a vision of the future always started by being an idea in the present, something that we just thought about developing. If we want to re-innovate the technology that's used to deploy telemedicine, then we need to start thinking bigger and brighter. Start thinking into the realm of things like VR technology. This is where my focus and what I've been working on comes in. This idea of using virtual hospitals to enhance doctor-to-patient communication, where literally everything can be on a virtual interface. You can literally immerse an entire hospital's, virtual world. It's amazing the applications of what this can do. So, to kind of demonstrate this vision of the future, I decided to create an actual virtual reality simulation. So, this is a three-dimensional model of a virtual reality simulation that I created using the Autodesk and Google Poly software to kind of deploy how an actual setting of the surgical world would look like in the virtual hospital and what doctors would be able to see exploring the interface. So, if a doctor is sitting in Canada in a hospital were to throw on a VR headset and tune into a VR surgical simulation halfway across the world, this is kind of like what they would be seeing. You can also think of this as almost like characters in a video game and how they're able to interact with each other, listen to each other, and kind of make it feel like they're in an actual physical world. Even if you have patients taking 3D scans through MRIs or head CTs, you can even have all that information uploaded to the virtual hospital, basically making it a central medical database instead of having that information in 2D communicated through medical records. This will completely revolutionize the way that we view medical care and really having a 3D lens to view so many different patients and their diseases and their organs.
So that was just a quick dive into some stuff that I was able to play around with when it comes to virtual reality and this whole new virtual hospital vision. I'm definitely going to be narrowing more in on how to create this actual vision with using 3D headsets and more sophisticated software in the future. But this is just a little bit of what I've been able to do with the software that I have.